Greetings, friends. This is Heath with Living Meta. If you've got a pain in your back or a little knot in your hip, I can't recommend enough the use of therapy balls to melt your fascia to feel much, much better with not a whole lot of time or effort. So, if you've got a tennis ball hanging around the house, or maybe you have some kind of systematized therapy ball, they come in different sizes, different shapes, different squishiness or hardness. There's even ones that have like vibrating, where they vibrate under your body. So many awesome options. But if you're just starting, get something squishy and soft, more like a racquetball or maybe even a slightly chewed up tennis ball if you've got a dog around. And also grab a blanket. And so we're going to focus either in low back or hip. There's a few great options. Find yourself on a floor or a little cushion carpet or mattress couch work, but having a little firmness is helpful. I've got an old lacrosse ball here, very inexpensive, nice and firm. And I'm either going to place it in my lower back, not on any floating bones. So don't be in your ribs. Don't be right in your SI joint, but more in the meat of the muscle, the upper QL, the lower QL. Those are great options. Or you could even be in the hip, like the piriformis or the gluteus medius. You might even work on your side, like near the TFL. So without further ado, support yourself and move on down. Knees bent, feet flat, and lean to the side. Place that ball in between your lowest rib and your hip. And then you just begin to rock your pressure toward that ball and decide, does that feel like a good spot? If it does, hang out, relax, melt. Or if you're still exploring, well, it's okay, but actually I feel like the tension's a little higher, roll to your side, bring that ball a little higher, a little lower. And you're looking for a sensory rich experience where it almost takes your breath away. You're like, wow, I'm feeling that. I'm feeling a lot. And you can begin to melt into it. Now, you could also work your hip. Maybe you've got TAS, tight ass syndrome. Not very clinical expression, but you get the drift. And I'm right in the middle of the glute. That's more piriformis. If you have any pseudosciatica, maybe check out glute medius, piriformis, these muscles on the top aspect of the hip. And you can rock side to side. You can hold stationary. You can even extend one leg flat or the opposite leg flat. Now, some of you, this will not feel comfortable. You need more padding. So roll to your side, grab that extra blanket or cushion, and put something between your body and the ball. So now I'm going to work those same spots, but instead of putting my whole body on the ball, I'm going to put a blanket between the ball and my body. I'm still looking for, where is that Goldilocks intensity? Not so much it's taking my breath away, but not so little that I'm not feeling that edge, that quivery edge of transformation. Now, once you find that perfect spot, hang out a good 30 seconds, 90 seconds, and go into exploratory mode with or without the cushion. So I'm going to place it right in glute medius, one of the common trigger point referral spots for pseudosciatica. And I could just hang out here. This is already about a 5 on the intensity level, 0 being no intensity, 10 being the most. And maybe I want it to be closer to like a 7. So to do that, maybe I shift my weight. I'm rocking my hips a little left and right. I push into my feet and I lift forward and back, left to right, diagonal. Or what happens if you flatten one or both legs? That creates a little more resistance, a little more body weight. Or what if you move the leg? What if I stretch the back of my glutes, my hamstrings, my SI, and I deliver that beautiful, satisfying pressure? I could twist, I could do some leg lifts, I could do some bicycling, you could do a figure four, stretch it out. So there's no reason you can't stretch the same side, or maybe you want to stretch the opposite side that you're working. So now I'm stretching my right leg while my left hip is getting the business. Maybe you find one more spot. Let's see what it feels like in the back, in the lower back. Again, please don't be in the middle of the spine on bone. That will not feel good. Sometimes placing a little sandbag, some kind of weight over your body is really nice, or even just a hand or two. maybe one hand to your heart, one hand to your belly. You could do restorative pose where you have your knees together, feet a little wider than your hips, maybe as wide as the mat, where the knees can rest together. Hang out here for 10, 15 minutes and relax. Although with the ball, you'll probably want to move it every couple minutes. Go for about 30 seconds to 90 seconds per area. And if it's particularly troublesome, spend more time on the side that gives you more challenge. So for most of us, pain is asymmetrical, meaning it'll be felt more on one side than the other. Maybe right low back, left shoulder, opposite hip, opposite knee. Anything like this is quite possible and likely. So that if you do have asymmetrical challenges, spend about twice the amount of time on the challenge side. Still get the other side, the so-called good side, but give it attention as well. However, spend about 2 to 3 times the amount of attention, effort on the challenge side, and you're going to feel incredible. You can do this on the ground. You could do this on a pad. You could do this standing up against the wall. If you're working with clients, you're a massage therapist, use this in your treatment room. Put a sanitized therapy ball underneath the sheet, between the table and the sheet, underneath the hip. Mobilize the leg, stretch the leg, massage, create some fascial reorganization through movement, through range of motion, dynamic stretching, call for motion. Above all, have a ball. Enjoy yourself.